Hi, I'm Hallie, and for this assignment, I interviewed my friend Ayana on nutritional genomics. She was not very familiar with nutritional genomics to begin with. She basically said she could guess that it had to do with how different people's genes may affect how they process foods differently. So we talked a little bit about what it is, and I gave her some examples of monogenic and polygenic diseases that are of interest in nutritional genomics. And to her, it seemed like a tool that seemed maybe helpful, but she didn't quite see the relevance for her. After watching the video, her first thought was, yeah, sure, why not? I'll do it if it's at the right price. But then she quickly said that the slick marketing of the video had really turned her off. And I think as we talked more, she realized she had more concerns than her initial reaction. She was concerned about how accurate it is. Um, what to do with the information once you have it. Is it statistically relevant? She did see how she could potentially have information that would help her to better supply her body with the nutrients it needs or avoid things that are harming her. Her biggest concerns were privacy. She was concerned about the information getting into the wrong hands. She was also concerned that that information could be used to make her ineligible for healthcare, which I think is a really interesting point. She was concerned that it could increase her anxiety around food and give her a feeling of restriction or increase her stress. She said that her provider would have to be able to counsel her about what to do with the information and give options. She said that protections and regulations she would like are for around privacy, that it's not shared, and that there's no identifying information along with the genomic information. She would want to know what happens after you get the information, how accurate it is, and where do we go from here. In terms of how it would make her feel psychologically, she wasn't sure if it would make her feel more anxious, but she definitely felt like she could see how it would have that potential. And as she found out she had a disease she was high risk for a disease with no effective treatment, it would be really upsetting. Although there's always the possibility that would help you to actually make different life choices. And so it's hard to know, would it be helpful information to have, or would it be just anxiety provoking? If she found out that she needed to completely change her diet, she said that it would depend on how the information was given to her and also how urgent the situation was, but that she would prefer it to be incremental changes, and that what would really help her make those changes would be to have a healthcare provider who was providing positive feedback and validation while she was making the changes. She didn't have any other thoughts right off the bat, but then we talked a little bit more after the interview, and that was a really interesting conversation. She asked me a little bit about my thoughts. I expressed to her some of the things that I had learned about that I thought were really interesting. I shared with her about the long chain fatty acid biosynthesis, the FADS locus. And I was just, kind of thinking out loud about, is that helpful information to know if there is a person who is not very efficient at converting ALA into DHA and EPA? Is that helpful information to know? Maybe it's not, maybe it is, but I could see how it could be. And then I also was talking to her about the MTHFR variations, and kind of along the same lines about, would that actually be able to inform your treatment choices and your treatment options if you knew that somebody had one of those variations that makes them more likely to be low in folate. So we talked about that. And then after the interview, I ended up going and doing some research on the MHTR variations. I did find a clinical practice guideline from the American College of Medical Genetics, and they concluded that there was not enough evidence to support MTHFR testing in thrombophilia, and a review article that also urged caution about the use of MTHFR testing because the utility is just not fully understood yet, and we need more evidence about if it's actually going to positively affect outcomes. I was curious specifically about the MTHFR variations and migraines, as I had heard there might be a connection there. And that was interesting because a search specifically about those topics did bring up some articles that thought that there might be utility in testing migraine patients for the MTHFR variations. Um, so one was an observational study that said, basically found that yes, if you know that somebody has this, you could give them folic acid, which can help their migraines. Um, and then I also found a review study that came to very similar conclusions that there may be some utility in patients with migraines. So that was very interesting. To me, it illustrates that I don't think I can feel one way about all of nutritional genomics, that this is really like a case by case basis. And, it would depend on the gene locus that we're talking about and the actual test. And it would also depend on the person and their specific concerns and disease states and all of that. So I think it would be about matching the person that's in front of you with the evidence for the testing. If somebody, if I disagreed with somebody, I think I would really try to give them the evidence and talk to them about like what are the things that would actually change if you got the results of this test. Is there anything we could actually do differently that would affect the outcomes for you? I think I would also really want to talk with them about how they would feel if they got some upsetting news, and make sure that they understood all of that. I think my friend was skeptical at first. In fact, I think she stayed skeptical most of it. She really didn't like the marketing aspect of it and the fact that people were trying to make money off of this when there wasn't a ton of science yet to back up, evidence to back up that we should be doing this. I think she was more receptive after having more of an open-ended conversation with me about it, but she was not that into the idea. She had very little previous knowledge, and I think she really wanted more specifics. So I think she kind of wanted to hear those specific things about how would this actually help her. I learned a lot about nutritional genomics doing this project. I knew very little to begin with, and I see a couple of areas where I think if the research continues to support this, that there might be ways to integrate it into a nutritional practice. One is with the MTHFR variation that I mentioned earlier. I think that's a really interesting area that maybe it could take some of the guesswork out of treating certain patients, like, for example, migraine patients. Another area is in obesity and type 2 diabetes. There was a study, the now randomized controlled trial in 2020, compared a kind of a lifestyle intervention group, the diabetes prevention program, which is highly effective, to a different intervention group that also included nutritional genomics testing. And they found that the people who did the nutritional genomics testing actually were able to decrease their intake of total fat and saturated fat much more than the group that just did the lifestyle intervention. So that's promising, but I feel like we need a lot more research on that. And as a nutritional professional, I think that there are several things I would need to do in my role when thinking about integrating it into a practice. This is a really rapidly evolving field, and I think I would need to stay informed of the current research and especially any practice guidelines. I would really want to discuss the utility of genetic testing with patients, including having them imagine how they would feel finding out different types of information. And I think I would have a responsibility to talk to them beforehand, and then also to really talk with them afterwards to accurately interpret the results and counsel them through that. A lot of the data that has been used to create these databases has been done with people of European descent. And I think this brings up another ethical consideration, that the tests might not be accurate for non-white groups. So I think going forward, I would really need to know the exact test brand, their accuracy, whether or not they are addressing racial and ethnic disparities that exist in these tests, and their privacy policies before moving forward. And I think there's a lot of details there that would be important for doing this ethically and well. So thank you.